And in the mitochondria is this unique enzyme called cytochrome C oxidase, which is a chromophore, which means it's stimulated by certain light, especially certain elements of sunlight, which makes sense. We're on this planet with a sun. It would make sense that just as sun affects the plants, the trees, and everything else, guess what? It affects all humankind, all animal kind. And so if you had a human who never got sun exposure and didn't use our bed, they were eventually going to lead to significant illnesses. Mm-hmm. You need sunlight.
Dr. Rothschild, thank you so much for joining me today. I really appreciate it. This is a topic that I am a huge fan of, and it's also a topic that you are quite the expert at. So I am so happy to have you here. You know, I'm curious about your background. I guess before I even get to how'd you get into red light therapy, I'm curious. You've been in LA, I believe, since 1983. What's your favorite thing about Los Angeles?
First of all, I got here in 75. I'm from Brooklyn, New York originally. I had no intentions of staying in Los Angeles, had no interest in staying in Los Angeles, but that's where the best and in the early 70s, I was exploring what I was going to do once I graduated from a very good undergraduate school called Stony Brook University out in Long Island. And I had great grades, pretty good grades, and I had a lot of opportunity, but I also was a bit of a hippie. And my definition of a hippie back then was I was more interested in helping people than I was how much money I was going to make. Mm-hmm. Sounds corny, but my goal has always been to help as many people as possible in the health world. And I got attracted to chiropractic. And so I drove all the ways out from Brooklyn to Los Angeles, no intention of staying here, to go to the, at the time, the best chiropractic school in the world. Things have changed maybe a little bit, but it's still a great school. And yeah, you know, I mean, people from New York are very stuck up. So they have better water, they have better pizza, they have better bagels, they have better culture, they blah, blah, blah. You know, so that's where I was at. You know, I'm like, this is Los Angeles. You have to, you know, there's nothing anywhere. There was really no downtown. There was no cultural center, sort of, but it was not like LA. I mean, not like New York. But I grew to love it here. You know, I made a lot of contacts. The weather is spectacular. And that's when I came out here, there were less than 20 million people in the state. There were more people in New York state than there was in California. Wow. And if you look at the statistics now, there are over 30 million people, maybe 40 million people that live in California. And there's about, you know, New York didn't grow. It's the numbers through the whole state. Mm-hmm. So at any rate, why do they move out here is because of the weather, is that's the main thing. But also it's people have a different attitude out here, and I kind of grew to enjoy that, and whatever.
Mm-hmm. Yeah. Okay. And so apologies on getting the years mixed up a little bit. Okay. So chiropractic, and then how'd you stumble upon red light therapy?
So there I am, a chiropractor. I started as a chiropractor in 1978. And I did well. I mean, back then it was, there were probably 2 other chiropractors in the area. When I retired decades later, there was probably 100 chiropractors in the same area. So I started in chiropractic when it was still in its infancy. As I started in red light even earlier, before it even got anywhere. What happened about 26 something years ago, I was introduced, well, I knew a medical doctor. He was a professor out of USC and an orthopedic surgeon. And he was the first one to really take red light therapy to a whole nother level. He got it FDA cleared, and I knew him. And he hands me this thing that looks like a flashlight, and he goes, "Save the world with me." And of course, I'm thinking he's drunk or something. It's like, what are you talking about? I'm going to shine a light. Now, at this point, I'd been in practice for 20 years. I knew everything. And, I didn't believe that shining a light on somebody was going to make a difference. But I used it. I mean, I said, okay, let me humor him and I'll try it. And within a month, the changes were remarkable. And eventually it revolutionized my practice. I was able to heal things I never dreamt of. This lady comes in with gum disease. Now, I become very familiar with my patients. I've been around with them for a long time. A lot of them consider me first before they talk to anybody else about what they're going to do in their life in the world of health. And she wanted me to know if I could help her with gum disease. And and the only thing we knew back then with red light therapy is that you couldn't hurt. So since I couldn't hurt someone, in fact, in the 50 years this technology has been studied, there's never been a recorded side effect. You couldn't hurt somebody with this stuff if you tried. I'm sure I'm going to repeat myself with that later on, but I helped her with a gum disease, and this guy with his kidney problem, and this guy with a ripped Achilles tendon, and any musculoskeletal bone, joint, whatever it is, but then, organs and gland. I mean, it was amazing. And imagine also that we're using equipment. I was using equipment back then that was thousands of times weaker than what we're currently using, but it worked. I mean, it was subtle sometimes. It wasn't consistent as it is now, but it worked. And then over the years, as the world of technology goes, things get better, they get stronger, they get more potent, they cover more parts of the body. And then about 13, 14 years ago, it was discovered that there was an element of light that actually can assist with fat loss. Now, listen, I don't know how much you know about weight loss, but there's probably nothing more popular and going to be bigger in the world of marketing. When I go to our marketing companies even today, and I say, what's the thing that will get more people than anything else into a practitioner's office? And it's almost always weight loss. Imagine weight loss. You're not killing anything. It's non-invasive. You're not destroying fat cells like ultrasonic cavitation, radio frequency. They're thought of as non-invasive, but you're killing fat cells. And then of course there's liposuction, all these different ways of freezing the fat or boiling the fat, whatever. It's all about killing fat cells. And imagine if we can do that. I mean, meaning that we can help fat loss with keeping the fat cells fully intact. Why do we want to do that? First of all, I'm a chiropractor. I'm not interested in putting anything in the body that doesn't naturally belong there. And I don't want to yank anything out that does belong there or injure or damage or anything like that. So this was ideal for us. And I'll go over the mechanisms later on, but I wanted you to know that when I heard that it could do that and saw some pretty decent results, that's when I started manufacturing. So that was about 13 years ago, give or take. Mm-hmm. And we were involved with lasers and pads and panels and all these different things, and they were good. In retrospect, looking back on, they were the state of the art at the time, and they were good. But what we didn't realize was what was going to happen next. And that was when the beginning of COVID hit. Our practitioners wanted less physical contact between the patient and the provider. And we came up with a bed. So the bed, the person can get, when people ask me about how much does it cost, I say, well, first off, you're going to save thousands of dollars a month because you don't need staff for this. The patient can get in and out themselves. With all the other equipment, somebody had to hold something or strap something on or whatever, you needed staff. But with the bed, the person goes into the room with the bed, they get in the bed, they get out of the bed, they come to the front desk, they wave goodbye to you because they've already scheduled and they've already paid in advance. That's what our answer was for COVID. Well, within a month of us having delivered the first series of beds, now again, we were only doing this as a substitute for what we had created up to that point, not thinking that it was going to take us to a whole nother level. But within a month, we were starting to get results that were absolutely startling. So I want to give you an example. Arnett was having a heart attack once, if not twice, a week. I'd never heard of that before. So they had 13 years ago, whatever, they implanted a defibrillator into his chest. So obviously up until that point, he was suffering tremendously. Then they implant a defibrillator into his chest. So every time he dies, it would zap him back to life. I'd never heard of that before, but here he is. By the time we met him, he was dying. I mean, imagine having hundreds of heart attacks. Imagine if you want to destroy a part of your body, restrict blood flow. So his whole body had restricted blood flow because his heart was suffering. He had severe congestive heart failure. So his practitioner calls me up and says, I got this guy coming in tomorrow who's having a heart attack on a regular basis. Should I even treat him? Because I don't want him having a heart attack in my office. And I said, why don't we treat him for 5? We didn't know what we would expect. Remember, the only thing we know for sure is it couldn't hurt. It couldn't hurt no matter what. And I've said that once, now twice, and I'm sure I'll say it again. You can't hurt anybody with this. So he said, well, it's worth a try, right? So just treat him for 5 minutes and stay in the room the whole time. So that patient went home that night. Now, that was almost 2 years ago. Hasn't had a heart attack since. He's had more treatment, but no more heart attacks. Hundreds of heart attacks, no more heart attacks. Dying, now fully vibrant. Everything he's doing now is it's like God sent to him, because imagine he surrendered to that he was going to die soon. And now he could do anything. His erectile dysfunction is gone. His energy is way up there. He says, what I wasn't expecting, that my energy would be through the roof. And it is. And even his skin, he had black moles, not a lot, but he had some black moles on his face. Incidentally, we noticed they're gone. But that's not the most important thing. His energy, his clarity, he went into church, and the parishioners came up to him and said, oh my God, you look so much better. It looks like you found life. And he goes, yep, red light therapy. And that's what you hear a lot when people, listen, I'm going to maybe say this again later, but I've been a chiropractor, had 12 practices. I know how to build a practice. I know what it takes. And from a referral point of view, it ain't satisfied people that refer. Somebody that goes to a restaurant and says, well, okay, that was good. They don't make a big comment. They don't tell a million people. But when you're excited about something, when you can't believe something, you're going to refer everyone you know. I just spoke to this lady. She referred 18 patients to the facility that she was going to, because that's how remarkable this was in her life. And she had a decent following. And so something like this, if you have something like this in your business, it's going to explode. It's going to be unbelievable. What drives business is passion and belief. If you believe in something and you have a passion for it, even if you're a lousy communicator, it's very easy to promote. So when that guy that was having heart attacks goes into his church and goes to the pastor and says, remember me? I had a heart attack in your facility, and look at me now. And it's just easy for him. So he built his own facility out there in Palmdale, California, and he's loving it. And so with that said, I mean, so that happened when we first started developing the bed. So this lady had 16 very serious conditions, but the thing that was bothering her the most was Lyme disease. And she sent me an email that said essentially that she had so many conditions. She had 3 forms of psoriasis, including guttate psoriasis, plaque psoriasis, and psoriatic arthritis. She had uveitis, which means that it was a precursor to glaucoma. So normally the pressure in your eye should be about 10, and the pressure in her eye was 180. And the only thing that they have for treatment for that was an injection right in her eye once a month. Each injection costs $5,000, and the $400 copay for the drops that she put in her eye. And when I asked her about it, and when I'm going to send you these videos, and they're welcome to share them with whoever you'd like, and they'll blow you away. If you're nutty like me, I wanted to help. Imagine, I wanted to help people. I wanted to help a lot of people. And now more than ever, I'm hearing, thank you for giving me my life back. Why do you think I became a chiropractor? That's what I wanted. Now, as a chiropractor, I had that occasionally, but now we're hearing it a lot more. Let's put it that way. So she had all these problems. I call her up. We do a testimonial. Mm-hmm. And she started off with the psoriasis, and she had rashes across her arms, down her leg, and I had pictures of that. But when I saw her, it was after she had been using the red light therapy, and her skin looked phenomenal. And her kidney problems, her heart problems, her thyroid problems, her Lyme disease, her shingles, her 20 years of diarrhea, all gone. She spent every month, she spent so much copay on the drugs and on the doctor visits. That was her career practically, even though she was working. She spent a lot of time at doctor's office, a lot of times with getting these drugs and all kinds of stuff. And now she doesn't need any of that. So to me, I sound like a nut. I think you probably think I'm crazy, but I am. I'm crazy about this stuff. And here's what you want to do. Try it. It couldn't hurt. It can't possibly hurt. Everybody you know who has an issue, I don't care what the issue is. It doesn't matter what the issue is. I don't care if you have third-degree burns. I don't care if you have cuts, wounds, sprains, strains, disc problems, neck, whatever. If you have brain issues, eye issues, mouth issues, thyroid issues, work your way all the way down the body. Try it. It takes 6 visits. Each treatment is 12 minutes. I'm not in practice, so I'm not inviting you to my office. I'm not trying to convince you to come see me, but we have hundreds of locations all over the country. And all you need to do is to go to the website, trifectalight.com, which I think is somewhere over here. Go to Trifecta. The Trifecta stands for the triple effect of face, fat, and healing. But that was early on when we realized it's really not just the face, it's skin, head to toe. So trifectalight.com, go to the Contact Us page, and on the left side, it says, find an office nearest you. We'll find that off. We can't post all the addresses and names and stuff for privacy reasons, but we'll find an office closest to you and go there. That's it. 6 visits, 12 minutes a dose. That's all. And after 6 visits, that's 3 times a week for 2 weeks. If you don't see a change, then there's one of 2 things that happen. One, they forgot to plug the bed in, or you have that rare thing that either 6 visits wasn't enough, which doesn't happen very often, or it won't work with you at all, which is even rarer. I mean, I haven't even heard of that. I don't care if it's the liver. I don't care if it's your intestines. It doesn't matter. Try it. 6 visits. So that's one thing. Now, on the right side of that Contact Us page, you're going to see a section there that talks about whether you want to buy the bed. Now, why would you want to buy the bed? The reason why you don't buy the bed is because you do not have an idea of how expensive it is to be sick. You have no clue. Now, I'm 72 years old, and I always taught my patients about aging gracefully. I can't stop you from getting older, but let's do it better. It's like a candle that burns really bright from the beginning to the end and then sputters out and dies. Wouldn't that be nice? But most people spend the last 20 years of their life not doing so well. In a wheelchair. Maybe they can't even communicate. I mean, they can't bathe themselves. They can't feed themselves. And worst of all, they can't wipe themselves. I don't want that for myself, and I wouldn't want that for anyone else I know. So the bed can help a lot of people not necessarily not get older. They're going to get older, but do it better. Do it more gracefully. So why would you want to buy the bed for yourself? It's expensive. It's not a free thing. It's $1,400 a month. But why would you want that? If you have more money than health, you got to do this until you learn how expensive it is to be sick. It costs a fortune. You have no idea. Not only are you missing out on life, not only can you not provide for your family because you're handicapped and not doing well, but on top of that, just the cost in drugs and doctor visits and surgeries and all that are astronomical. So you just want to try the bed. Now, on the other side, if you're in a business, anyone to do with well-being, massage, the whole fitness industry, weight loss industry, because I'm going to tell you in a minute, as I mentioned before, that when we found out that it can help with weight loss, you can create and help with assisting people with their diet and weight loss. So there's so many people that will benefit tremendously if you have this bed, it becomes a centerpiece. It becomes this amazing thing that will attract more people than you can believe. And like I said, you'll get more excited people than you've ever seen before. And many of the people will refer a ton of people to you. And we do that in training. We include basic training, advanced training, and we assign a coach to you that will help you figuring out how you're going to grow your business tremendously. In fact, we include 32 things with the purchase that will make and assure you every file, every folder, every video that you're going to need. Plus, we do lots of webinars, and we have tons and tons of stuff to assist you to be as successful as you possibly can. So,
Okay.
with that said,
let's let's go
Before
to
you ask a question, I'm going to tell you somewhere coming up is why and how it works. But go ahead.
yeah, that was the thing to go into is it's obvious that light is a essential nutrient, and but what exactly is going on that's eliciting all these changes for people? Because I know there's different types of light.
Well, there are, and a lot of people don't understand that. I've been doing this for 27 years. I know light inside out. I wrote the book. In fact, I don't make a dime off of this, but if you go to Amazon and put in the word Illuminated Healing, you can get my book. I think it costs $14 or something like that. You can get it as a Kindle, which means you can, I think it's a few dollars, and you can read it off your computer. You can get it as a book, or you can get it as at Audible and have the pleasure of listening to me talk for 8 hours, because it's a 280-page book. And it's chock full of the information that will assist you. So now let's talk about the mechanism out there and the different colors and the different schemes that people come up with. But the truth of the matter is that the first thing they discovered and they were experimenting with was the healing aspect. And that started 50 years ago when they coined the phrase photo, P-H-O-T-O, which means light, bio, which means tissue or cells or something like that, and modulation. And essentially, photobiomodulation was the study of how light could affect the body. And they were surprised with the amount of results that they're seeing. Because we know if you look outside, you'll see the trees and the grass. Guess what makes them green and makes them healthy? It's the sunlight. And guess what heals us? Elements of sunlight. That's all we do is take 4 glorious elements of sunlight and drive that into the body. And we'll talk about that in a minute. But there are 2 separate mechanisms. The fat loss, which was a complete surprise that they learned a little over a decade ago, and then the healing, which we're going to talk about later. Let's talk the easy stuff about fat loss. When it first was discovered by accident that light could actually assist in losing some fat on the body, it was considered or thought that it liquefied the fat. It melted the fat. That's not what happens. Over the years, what they finally discovered is that there's an element of red light, only red light, that can actually assist the cells to get rid of some of the fat that's in them, the fat cells. Now, fat cells have a terrible name, I guess, because people think, let's kill them, let's destroy them, let's freeze them, let's boil in them, let's do all these different things. And that's about destroying. And as I mentioned before, that's not what we're about. What they found is that the certain element of red light will actually change the fat cell wall to become more porous and allow the fat contents that's under pressure. Every cell in your body is under a little bit of pressure. And if you poke a hole in there, some of the contents are going to leak out. Well, these micropores form on the outside wall of the fat cells and allow the contents to leak out. Now, this only lasts for a day. And so then the fat cell walls are completely back and the fat cell is not damaged in any way. And with our unique protocol, we move the fat away from the fat cells, eventually to the liver for use or elimination. That's it. That's fat loss. Does it work? Yes. There are some restrictions. You know, someone can't go home and pig out every night and get drunk because alcohol is the worst when it comes to fat loss. You're going to find very few people that know about fat loss as well as I do. My mother was an executive Weight Watchers when I was a kid. We never had a good thing to eat when I was a kid. Bean sprouts instead of spaghetti, and I can go on and on the torture. But I learned about fat loss. I learned about weight loss. I learned about the tricks of, where people would use to not just lose the fat, but keep it off. It's easier actually to lose the fat than it is to keep it off. And so that's why when we go through the training, we teach people about the Keep It Off Club, but that's a whole nother thing. So that's fat loss. That's weight loss. But again, I didn't start that many years ago as a chiropractor for fat loss. It's great. It attracts more people to a facility than anything else. But I love the healing aspect more than anything. And what they discovered is that, there's this thing called the rainbow. And it starts with violet, goes all the way to red. And past violet, you got ultraviolet. Past red, you got infrared. And so to that end, I want to just mention the word infrared. Infrared, which is invisible to naked eye, there is no such thing as just infrared. It's either far infrared or near infrared. The word infrared when people say that they have an infrared sauna, they have an infrared, they're usually talking about far infrared, which is really nice way of getting heat. But if heat was the answer to this whole thing, I'd just tell you to go take a hot shower or get in a jacuzzi. That's not what this is about. In fact, heat is the enemy when it comes to the healing aspect. Because what does heat do? It drives more blood to the surface of your body. That's why you might get red or, whatever. And so it blocks the penetration of the light. You don't want heat. If your device is getting heat, we know that you bought this cheap piece of junk from China. Guaranteed. That's what people think there's competition out there. It's China. That's the biggest competition because they dump crap on the market and people are looking for pricing more than they're looking for quality sometimes. Would you go to the cheapest MRI center or would you want to have quality? Yes, MRI is not something that people typically buy for their home. They go to a center and they have it done. Just like this. If you can't afford what I described for your home, then just go to a local center to you and change your life. It will change your life. So when somebody can't see, we had a guy that had Leber's hereditary optic neuropathy, which is essentially it's like multiple sclerosis of the retina. And multiple sclerosis is eating away nervous tissue, but this LHON targets the retina. So this guy's going blind. He had already surrendered to the fact that he was going to go blind. But as a last resort, he got involved with us and with red light therapy. And we had no idea whether it was going to help or not, right? How would we know? We didn't know. We knew that it couldn't hurt. And within a relatively short time, what we were able to do is halt the progression. They'd never seen this before. He did not get any worse. The same thing happens with multiple sclerosis. They don't get any worse. But we're not going to grow back the destroyed tissue. It's already been destroyed. It's like a cavity in a tooth. We're not going to grow that bone tissue back or teeth back, but at least we can halt the progression. And so this guy who had headaches, especially migraine headaches, all kinds of symptoms. I was going blind. He doesn't have any of those symptoms. And the sight he's lost, but he's not going to go totally blind. So yeah, he was thrilled with that. So let's get back to why and how it works. What they discovered, and this took a while for them to discover, is that essentially this is sunlight. We're taking glorious elements of sunlight, 4 wavelengths, only red and near infrared. Remember, we already talked about what infrared is. It's invisible to the naked eye, by the way. So when you see these lights, they don't light up. And someone will say, hey, what's wrong with it? Near infrared is invisible to the naked eye. So what lights our bed up, because we integrate red and near infrared, is the red lights. The near infrared lights don't light up. So what did they learn? Especially near infrared and a little bit with the red, is that it stimulates every cell in your body that gets exposed to this light. And the depth of penetration is unbelievable. Now people say, well, it's skin surface only. Okay, well then why are people having such amazing results with deeper tissue? With the heart, with the spine, you name it. We've, kidneys are superficial, so that makes sense. But some of the deeper tissues also respond beautifully. So you get this person who's a diabetic, and all of a sudden they need less insulin. When I say all of a sudden, I mean over a period of time, I should say. But they need less insulin because it will actually affect their pancreas as well. So let's get back to why it works. Certain elements of light from the sun will stimulate the tissues of the body. So now let's go into a word called mitochondria. And perhaps you've heard it before. When I went to school, we learned that there was one mitochondria in every cell of your body. It turns out that's not true. For example, the heart, which has the highest demand for energy in your body, has over 5,000 mitochondria in every cell. And the mitochondria is the powerhouse of your body. It's the reason why you breathe oxygen and eat food, to create this unbelievable molecule called ATP. It's the energy currency of the body. Without it, or let's say we have a deficient amount of ATP in the body, that will lead to disease and eventually death. So if we can reverse that, if we can get you to have full ATP production, if we can have you not have mitochondria dysfunction and reverse that, then almost any disease out there, we can help. Or if somebody burnt something, cut something, sprained something, whatever, we will accelerate healing dramatically with that light. So first, I want to explained why it works on every cell of the body. Because every cell has mitochondria. And in the mitochondria is this unique enzyme called cytochrome C oxidase, which is a chromophore, which means it's stimulated by certain light, especially certain elements of sunlight, which makes sense. We're on this planet with a sun. It would make sense that just as sun affects the plants, the trees, and everything else, guess what? It affects all humankind, all animal kind. And so if you had a human who never got sun exposure and didn't use our bed, they were eventually going to lead to significant illnesses. Mm-hmm. You need sunlight. And absent that, you need our lights. Now, even if you get sunlight, we're talking about magnifying this thousands of times and then driving it into somebody's body, deep penetrating to affect as many cells as possible, to bring those cells back to life. So that what we learned is that this only works if you bathe the whole body at the same time. It was discovered, as many things in technology and health are discovered by accident. The bed was developed because of COVID. But once we started seeing these miraculous results, we realized when you bathe the whole body, top to bottom, left and right, front and back, inside and out, that's when you're going to get these miraculous results. And I know the word miraculous sounds very immature and not scientific, but I don't know how else to describe it, because those are the kind of things that I get, not every day, but frequent enough, where someone will call me up and say, hey, you didn't tell me it could help this guy for that problem or that guy for this problem. You know, so this lady had stage 4 renal failure, which means she was close to needing dialysis. And her last resort, let's try red light. And now her kidneys peaked up and they're perfect. They came back to life and they're fine. And yes, she calls me up. She's excited. She refers a ton of people to that facility because that's the way it goes. When you affect people so remarkably, they are excited. So when someone gets in the bed, they don't wear the goggles. They just keep their eyes closed. So I'm telling you that the light can get through your skull and get to the brain. And to affect the brain in such a positive way, I got an email from this lady. She said, if this is how everyone else feels every day, I can't believe I've been missing out all this time. This woman hated her life up until the point she started red light therapy. She was depressed. She had all kinds of sadness, I guess is the way I would put it. And after a couple of weeks of losing the light, and ever since, it's changed her life. So even psychologists, now they're the toughest. Every psychologist I talk to pretty much goes, oh, it sounds like it's a placebo effect. Really? You're going to get a guy that has a defibrillator in his chest, having regular heart attacks, and now he doesn't have heart attacks, and that's a placebo effect? You know, they just can't believe that if it isn't a serious drug, that it could possibly help the person. And what I tell them is, just try it 6 times. That's it. Try it 6 times. And what you're most likely going to do is call me sometime or get in touch with me. And if you want to get in touch with me, when you go to trifectalight.com to the contact us page, just write in there, please get this to Dr. Rothschild, and send me a note and ask me whatever question you want. And you know, it is remarkable. It is unbelievable. And I'm sorry if I sound crazy, but I love this stuff. I mean, again, this is what it was all about for me. So
I'm curious. I'm sorry to interject. I'm curious about trying it 6 times, right? What is it about using it 6 times? Is it?
So, you know, again, I've been a chiropractor, seen tens of thousands of patients, and there's that window. With chiropractic, I usually wanted 4 visits. And I would just say, look, just give me 4 visits. And at the end of the 4 visits, we're going to sit down and have a discussion. We call it a report of findings. This is where you were when we started. This is where you are now. And so this is what it's going to take to get you to a goal that we established on the first visit, whether it's fat loss, whatever it is, you know, better range of motion, kidney function, whatever the functioning that you want better, we will determine what it's going to take to get you better. And that's 3 times a week until we reach our goal. Now with light therapy, often we'll see it after just a couple of visits, but I like to give myself that window of 6 visits. Probably you'll see it sooner than that, but I would say give it 6 visits. Usually on the 5th visit, if the person is not seeing anything, which is so rare, they'll go, "Doc, don't give up on me. Give me a couple of more visits. Let's try it, so I feel confident that this will make a difference." Because maybe they came in for this problem, but so many other issues. Remember, we're treating them head to toe. So besides the issue that they came in for, they will sleep better, have better clarity, have better digestion. Their skin's going to look better. So many other things will result in better result. So many things will come to better results. So I want to tell you, don't believe me. I want you to go to Google Scholar. Are you familiar with Google Scholar?
Mm-hmm.
So it's scholar.google.com. And put in the phrase red light therapy, which is not the most accurate way, but just do this, red light therapy, and then press enter. And would it surprise you that you will come up with 3.5 million reviews, double-blind studies, research papers, and articles, all kinds of stuff. Then filter it out to lupus. So you got red light therapy, lupus, red light therapy, whatever. Whatever you want to put in there. And you would be pretty rare that you wouldn't see a lot of studies on each one of these things. So don't believe me. First, try it. And second of all, check out Google Scholar. I highly recommend that. I also recommend that you go to our website, as I already mentioned, but I also recommend that you go to our YouTube channel. So when you go to YouTube, you put in the word Trifecta Light Official, and you will find over 120 videos. And they're great. They're really well done. Some of them me being interviewed, other people being interviewed, all kinds of stuff of how and why this stuff works. So, but I'm also going to send you raw video. Some of the stuff can't be on our website and can't be on YouTube because somebody might say it's making claims. And in my mind, all I'm doing is reporting the news. If I call up somebody and do a testimonial video with them and they tell me it did this, this, and that, what am I supposed to lie and say they didn't say that? So when, kidneys and liver, and they're all coming to me with all kinds of issues, and especially all the musculoskeletal issues. So we had the brother of a very famous person. And the brother's pretty famous also, but nothing like his brother is. And he was using our bed for back and shoulder problems that he was guaranteed by his orthopedist that he's going to need surgery. And within a month, he calls up the surgeon and says, "I don't need surgery. My back's great and my shoulder's even better." And so we get that all the time. So then the question comes up, why isn't this even more all over the place? Why isn't it every hospital? Why isn't it every wound center? If I told you that a person with a 3rd-degree burn can get in the bed, and now by the wound center, they were guaranteed 6 months of pain, 6 months of drugs, and permanent scarring at the end. And by the end of the second week, the pain's all gone. And by the end of the 3rd week, it's all gone. It's like it never happened by using the red light therapy. So why wouldn't this bed be in every wound center? Why wouldn't this bed be in every OR? Why wouldn't this bed be used a lot? It's because there's a lot more money to be made by not using red light therapy than there is using red light therapy. The money in the industry comes from sick people, not from healthy people. You healthy people out there are not helping the pharmaceutical industry or hospitals or doctors to make money. Their rooms are filled with sick people, not healthy people. And they need more sick people. They don't need red light. They don't want red light therapy in their lives because it's a revenue killer. But certainly it's going to decrease revenue for sure.
So I have a question on what are a couple of the most common misunderstandings or misuses of red light therapy?
I'll tell you the most common thing is people want to know if it's a lot of power. They think the answer is about power. Now remember, it's not about power. We could have had unbelievably powerful lights 27 years ago, but they would generate so much heat it would be self-defeating. Remember, heat draws more fluid to the surface and blocks the penetration of the light. So it's not about power, it's about efficiency. You want cool lights that are very powerful, but not hot. And that's why 27 something years ago, we called it cold laser or cold therapy. They weren't literally cold. They didn't get hot because we recognize that you want to be under the radar, not let the body know something's coming, because it will then bring more blood to the surface and block the penetration of the light. So to be subtle, we want efficient lights that are strong without heat. It's not about power. It's about efficiency and quality. That's the most important thing about our bed, is the highest medical grade lights possible. That we're constantly doing research to have better lights. So we started off with the bed with our Pro 100, then we went to the Pro 200, then 300, then 400. This is the Pro 450 that we're involved with now. And within that, we've made several improvements even beyond that. Because as we get stronger lights that don't burn hot and higher medical grade lights, we're going to include that. We're going to have that as part of our equipment. The other thing is you want the capability of having the lights as close to the body as possible. So when you see lights on the wall or the ceiling or whatever, they're nice. But when you come away from the body, you lose power exponentially. You want the lights as close to the body as possible. So when our canopy comes down onto the person's body, it's right on their body. Not the weight of it, it approximates their body. So you want the lights as close as possible. Number 3, you want the capability of customizing the treatment. So a person who's 400 pounds with a lot of flesh can absorb a lot of this energy without generating heat. And someone who's 80 pounds and has zero flesh, we can't have it as strong. So we have the capability of customizing the power so that the person gets the right amount of juice into their body that their body can accommodate. But the other thing is that we have the capability of pulsing the wave. So you can have constant wave, and we didn't have the capability of pulsing the wave in the past. Now we have the capability of pulsing that wave. So some of your audience might be familiar with resonating frequencies, energy healing, things like that. It's about using frequencies that resonate with different tissues. So every tissue in your, well, many of the tissues of your body resonate with different frequencies. And so we can set the bed, and we train the person how to do it. It's very easy to set the bed to the right frequency for the condition that we're involved with. So we can change the power, we can change the frequency. We have more power or less power going to the top or the bottom because we can control the top canopy separate from the lower bed. So all of these features, you want to get the best results possible. Our cheaper, crappy stuff out there work? They do something. Mm-hmm. But if you want consistent, strong results, if you can't afford it for yourself, go to one of our local facilities and use it. If you can't afford it, you're going to go to the website and you'll learn how to use that. Now, also remember, you're going to get my book if you like. It's called Illuminated Healing. And hopefully I've answered a bunch of questions. I love this stuff. So if you have questions, go to the website, ask me whatever you want. I can tell from the questions that some people ask that they've spoken to some other company that doesn't know what they're talking about.
Mm-hmm. Yeah. So a lot of the red light devices out there, yours is full body, and most of these other ones, a lot of them are pretty much partial covering.
Which I have no objection to. I mean, face mask, helmet, they're fine. Yeah. Okay. If you want a toy and you want to play around, that's fine. If you want to make major medical changes in your body, then you need full body. That's rule number 1. You need full body. Rule number 2 is you want the best bed out there.
Okay. And when you're using a bed, I think you mentioned earlier about not having any goggles on, right? And just keeping your eyes closed.
Yes.
Okay. And
so that lady that had uveitis and had her pressure in her eye was 180, mm-hmm. requiring injections in her eye and drops. And after a short period of time, her uveitis is gone and her pressure is normal. That's what you want. You want that. But you see, I'm a chiropractor. Number 1, as a chiropractor, it's about holistic. Mm-hmm. So if someone came in with an elbow problem, you got to know that I'm going to treat their spine. I want to make sure the nerve flow to that elbow is perfect. So I'm not just going to get a magnifying glass and only stare at the one thing they think is their problem, because there are multiple issues that might develop as to why that elbow became an issue. If they had perfect nerve flow and blood flow, maybe their elbow would not have been a problem. So I like full body because I'm a holistic practitioner. Now, the other thing is, this is what chiropractic's about, and other natural healing is about also. We recognize that the body knows a hell of a lot more than we do. It's called innate intelligence. Whether you're a religious person or evolution, I don't care. But the body knows what it's doing, and what our job is to remove the interference. So if someone had a cut, our job is to clean out the cut, cover the wound, and then let the body do its thing. And that's true with this as well. All we're doing is we're enhancing the body's capability of doing it, of healing itself. And that's what lights are about, enhancing your own body's ability to do its job better. Does that make sense?
Yeah, absolutely. It makes sense to me. And so listeners might probably want to know this, some of them, and it's about the dosing guidelines, right? In terms of wavelength, intensity, duration. Will there be different time frames and time allotments for that, depending on if something's maybe for a cognition issue or a recovery issue, or across the board, is it going to be the same time and everything?
A dose is 12 minutes, period. Now, somebody might need 2 doses in a day, but a dose is 12 minutes. Most everything happens in 7 minutes, but we lock in those results with a 12-minute dose.
Okay.
So if I have somebody that is in really horrific shape, we might see them twice a day, but a dose is 12 minutes. We might see them, by default, treatment is 3 times a week, just like a workout. I'm 72 years old. I want to stay as young as I can, for as long as I can. And so I get into bed 3 times a week without an ailment, but I'm doing it preventatively. That's my recommendation for everybody. Get in the bed 3 times a week for the rest of your life. And then a number of drugs you're going to need, the amount of surgeries and hospital stays will drop dramatically.
Is there a such thing as getting too much, right? Could I just do it every day for 12 minutes if I wanted to?
There's no such thing as too much as far as danger to your body, but sometimes you're wasting time. Like, for example, if you go more than 12 minutes, you can go a half an hour. It's not going to make it worse, but you're just wasting time and money.
Okay.
12 minutes is a dose. And by the way, 12 minutes is a dose. Now, as far as doing it every day, I got a lot of people doing it every day. That's fine. The default setting for chronic condition is every other day or 3 times a week. But there's no harm in doing it more often. 3 times a week is sufficient for almost every chronic condition out there. But like I said, if you have an emergency or a serious problem, but then I want to talk to you about athletes. If you're a serious athlete and you're not getting in our bed, you're going to lose to the guy that is, because it will enhance their ability, their stamina, their speed. I had a guy that called me up and says, I could swim twice the distance now because of the bed, not because their aches or pains or joints, it's because their stamina has been increased so dramatically. So we have it with athletic teams. You're going to see, a lot of famous people are starting to use red light therapy. They're using the wrong equipment, but even lousy equipment is going to do something.
Yeah.
So we have it with an NBA teams. We have it with the Olympic Training Center, an Olympiad training with the bed. They get in the bed in the morning. They do their intense workout that's unbelievable. Normally by the next morning, they can barely get out of bed because they're exhausted from the day before. But if they're using the bed before and after every day, they're using it twice a day, their workouts are unbelievable and their energy is unbelievable. So on the videos that I'm going to send you, one of the lady, she's a professional pole vaulter, and it enhanced her ability. Now, she was too young to be in the Olympics, but she's primed for this 2028, and most likely she'll be in the Olympics. And we better bet that she's using red light therapy a lot in her professional career.
Okay. Yeah, that was one of the reasons I was asking, was for athletic purposes. And then another reason I was asking is because some people maybe depending on where they are in terms of the latitude, they might not be able to just get as much sun outside. And so I was just wondering if then that can kind of help those people
Oh,
who,
absolutely. There is
yeah.
no such thing as seasonal blues when
Mhm.
you're using our bed. None.
Yeah. Yeah.
The results are spectacular. Now, I'm in California, so I don't see that, seasonal blues. But we have a lot of people all over. We have hundreds of locations all over the country,
Mhm.
and so people are telling us about seasonal blues and how this resolves that. I
Yeah.
mean, that's minor compared to the things that people are telling us about, but again, you asked me about the eyes. So they get in the bed, they just keep their eyes closed. Is it a danger if they had their eyes open a little bit? No, but it's a very bright light. It's annoying. It's so bright. So just keep your eyes closed. If you wear goggles, you're not going to get this glorious stuff that can affect your eyes, which includes macular degeneration, macular edema, uveitis, glaucoma, floaters. I mean, that's a simple one. Within 2 weeks, almost everyone I've spoken to, the floaters are gone. And as you get older, I mean, a lot of people are affected by floaters. We had this one guy, his floater in one eye was so large that it affected his eyesight. Usually it's just annoying. It's like it feels like nets that are crossing your eyes or something like that. But with him, it affected his eyesight. And that was gone within 2 weeks. So floaters are a real slam dunk with this. But if you're wearing the goggles, you're not going to get that glorious result. So you just get into bed. If I'm telling you it can pass through the skull and get to the brain, it can get through the eyelid
Mhm.
and get to the eye. So just keep your eyes closed and open it up a little bit if you want. It's not dangerous. It's just it can give you a headache with a bright light after a while, and the headache will go away. But I don't want people feeling, a headache after the treatment. They can avoid that. Just keep your eyes closed.
Yeah. I'm curious, where do you see the future of red light going maybe the next 3 to 5 years? Do you think it's going to get adopted more in a healthcare system
Oh,
or?
absolutely. When somebody goes to their doctor and said, I don't need those injections anymore, I don't need that surgery anymore, eventually somebody's going to be smart enough to say, I either better get on this wagon or I'm going to be left behind.
Mhm.
So, but the truth is money talks, and you can make so much more money without red light therapy. That's the biggest in this country. That's going to be the biggest thing to get past. Now, the beautiful thing is that whether you're political one way or the other, RFK Jr. has put an emphasis, and it's going to be very difficult for him to do, but he wants the medical profession to emphasize healing more than profit. Now, that's not what it's been about. It's been a profit center. Average medical doctor is going to be a multimillionaire, period, in the United States. And it's because they make so much money from keeping I got to be careful what I say, but it has to do with getting people, not helping them to get unsick. It's about keeping them sick, I think. But and our food industry, there are a lot of food elements in our country that can't be sold to other countries because they refuse the poisons and stuff that we have in our country. And hopefully they're going to stop that too. But it's a big road. You've got such huge lobbies that fight so much for keeping their money that's, you ask me, where is it going to go? It's going to go, where it's going to become more prevalent, more obvious everywhere. But you're butting up against an industry that doesn't want to give up on their money. Listen, ulcerative colitis is horrible. Bleeding, diarrhea. And they try all kinds of stuff. They try prednisone and various cocktails and whatever. And sometimes they work and sometimes they don't. But one of the things they use is a biologic. And when they moved to biologics, they made so much more money because what is a biologic? You have to go to a center and it's introduced into your body as an IV, right? You can't do that at home. It's not an injection, it's an IV drip. So they do that, and a 1-hour drip of this one particular drug for ulcerative colitis. Would you like to take a guess? And you have to take a guess of how much that 1-hour dose cost. Take a guess.
Let's see. What, $6,000?
And then add a zero.
60?
A little bit less. So it's $55,000.
Oh, wow. Way
One
off.
dose. You weren't way off, because that's, yes, I mean, that's outrageous. $6,000 is outrageous. 55,000 is, are you kidding me? So how do you compete with an industry that can make that kind of money? It's not easy. And I've been doing this battle since 1975. 50 years, basically. I've been in that battle, and I surrendered to that battle. You know, I'm not killing myself about it.
Mm-hmm.
We lost. We're gaining some ways, but imagine the kind of commercials that are now about drugs on television primarily are telling you, the person that's watching this commercial, to go to their doctor and tell the doctor he's wrong for prescribing that. He should be prescribing what the commercial is telling the patient to tell their doctor to prescribe. I've never heard of that before. That's been going on for years now. And does it work? Well, why would they be spending billions of dollars on those commercials over a period of years if it didn't work? It works.
Oh yeah, it definitely works.
So drug use is bigger than ever. I started in 75 with the goal in mind to have less drug use, and we screwed up. We failed miserably because people are taking more drugs than ever before.
Yeah.
Prescription drugs I'm talking about, and over-the-counter drugs.
Yeah. Well, I think if anything, people are, I don't know, me personally, I don't have faith in, I guess, legislation having sweeping change. I do have faith in a few more people becoming a little more sovereign with their health and taking more ownership of that, and looking into things such as red light therapy and other areas instead of waiting to get told what to do. So I see a little small uptick in that, but not as much as I like. But
I mean, listen, when I started in red light therapy, nobody was doing it. Now it's a lot more popular.
Yeah.
And so sometimes these things have to be done despite your medical doctor. He's not going to prescribe red light therapy typically, or she. So you need to do it yourself. And that's what this is about. The health practitioners that we work with are not typically medical doctors. We have some, but they want to make the money. And the money is in surgery.
Yeah.
Not otherwise.
Yeah. Let's see. You mentioned you're 72, I believe, and you have better energy than a lot of 20-year-olds I'd see. So I'm curious, what's a typical wellness regimen for yourself?
Besides using the bed, I got to tell you that I don't put anything in my body that could do harm.
Mm-hmm.
I don't let anyone take anything out of my body. So I don't, I'm going to drive you crazy with, they used to call me, I went to a party one time. It was a kid, I was like early 20s. And they go, hey, come over here. The alcohol's over here. Well, I don't drink alcohol. Oh, okay. Well, how about over here? Because they're probably smoking dope or whatever. No, I don't put anything in my body that's not right for me. How about coffee? No, I don't drink coffee. And so the next day when we were at the back in school again, he screamed across the room, hey, no vices, because you have no vices. And it kind of stuck. Some people started calling me no vices.
No vices.
Here's what happens. The reason why some people don't take care of themselves is because they're not scared enough. They don't know that what they're doing today, they go, oh, I can drink a six-pack every day, and I'm living for today. No, you're not. You know how I know that? Because I treated a lot of you at an older age crying that they wish they had taken better care of themselves when they were younger. How stupid can you be to not realize that you're going to wind up spending the last 20 years of your life miserable? Why do that? Now, I know I'm older than I used to be. There was things, I used to fly down the stairs, and now I walk down the stairs. And I used to do things, energetically wise, that I can't quite do as well as I did before. But, what I tell all of you is just do the best you can. That's the best you can do, right? Some people have been dealt a lousy deck of cards or set of cards or whatever. And so you got to deal with what you got. You deal with what you have and do the best you can. So if you have a weakness with your pancreas, you might wind up a diabetic unless you take better care of yourself. So stay away from the starchy carbohydrates, simple sugars, sodas, and alcohol. Do that. And there's many other rules about fat, fried foods and all that, but I don't want to drive everyone nuts, but I don't do any of those things. So yes, the bed makes a big difference for me. But if you do the bed and do everything else lousy in your life, we know smoking's a killer. We know alcohol is really bad. But in this country, because you can't show smoking on television any longer. No one's smoking on television, movies, whatever. And when they get in the car and they're about to take off because they're being chased by a dinosaur, the first thing they do is they buckle their seatbelt, because everybody has to have a certain thing on television. But drinking alcohol is the coolest thing on television, and everybody's drinking alcohol. You come home and you have a lousy day, boom, have a drink of alcohol. I don't do that, and I'm not bragging. I just I never liked the taste, but I also wouldn't like the way I felt the next day. I'm not interested in that. But if you can limit the crap and increase better life, better thinking, and all that, my goal is not to live longer necessarily. I want to have the highest quality of life I could possibly have.
Mm-hmm.
Not bragging.
No, I think that's a great message to hear. It's also a great way to kind of wrap up this conversation here. And just again to I guess remind listeners and everything, and I'll have all this in the show notes as well. Where can we go for more information?
Trifectalight.com.
Okay, easy enough. And I will have that in there. I'll have his book in there. And I really enjoyed this conversation. Thank you so much for sharing those stories and everything. And that just makes it realer. And I'm sure listeners and viewers are going to appreciate that.
My pleasure. You take care. Everybody out there, just do the best you can.
Absolutely. And listeners out there, stay awesome, be limitless, and optimize today so you can lead tomorrow. Peace.